Welcome to NAS Quick Anatomy. This is the upper limb module, and the topic is the axilla and its boundaries. How to navigate through the lecture. The video will play continuously. To stop it, press pause. To continue, click play. If a question is asked of you, 1. Click pause to think about the answer. 2. Then click play to show the answer and pause immediately to reflect on the answer. 3. Then click play to continue the video. You can also use the scroller to move the video forward or backward. You can click on More to see the timing of the various segments. Pause if you want to know about the author. Pause if you want to know how to optimize your learning experience in anatomy. Pause if you want to read this page. The axilla. What is the importance of studying the axilla? The axilla is somewhat of a complex region to study, but clinically it is significant for the following reasons. 1. Practically all structures that supply the upper limb have to pass through the axilla, and so also structures returning from the upper limb to the thorax and the neck. Number 2. Quite a number of surgical operations are performed in the axilla. If the surgeon has insufficient clarity of this area, it is highly likely that he would injure some vital structures with dire consequences. 3. Operations commonly performed in the axilla include A. Axillary lymph nodes clearance to impede the spread of breast cancer. B. Axillary nerve blocks of various parts of the brachial plexus during operations involving the upper limb. C. Draining of axillary abscesses. D. Repair of axillary artery in aneurysms and penetrating injuries. So, what is the axilla? The axilla is described as a truncated pyramidal space between the upper part of the arm and the upper part of the thorax. What do you mean by a truncated pyramid? It is simply a pyramid with the top part cut off. Let's remove the anterior wall. What forms the boundaries of the pyramid? That's the inlet, there's a base, there's a posterior wall, there's a medial wall, there's an anterior wall, and a lateral wall. Let's insert the truncated pyramid into its position in the body. This is the inlet, this is the base, this is the posterior wall, this is the medial wall, this is the anterior wall, and that is the lateral wall. We can refer to this picture as the classical view of the axilla. Let's study the posterior wall. Let's remove the purple cover of the posterior wall. Question: what forms the posterior wall? 1. The subscapularis. 2. The teres major. 3. The latissimus dorsi. The posterior wall has 3 important intermuscular spaces or gateways. 1. The quadrangular space. 2. The triangular space or the upper triangular space. 3. The triangular interval or lower triangular space. Question: to what region are they gateway to? The quadrangular space is the gateway to the posterior shoulder region. 2. The triangular space is the gateway to the posterior scapular region. And 3. The triangular space is the gateway to the posterior compartment of the arm. Let's enlarge the picture. Question: what are the borders of the quadrangular space? 1. The lateral border, neck of the humerus. The inferior border is formed by the upper border of the teres major. The superior border is formed by the lower border of the subscapularis. The medial border formed by the lateral border of the long head of triceps. Question: what are the borders of the triangular space? 1. The lateral border is formed by the medial border of the long head of triceps. 2. The inferior border is formed by the upper border of the teres major. 3. The superior border is formed by the lower border of the subscapularis. Question: what are the borders of the triangular interval? 1. The superior border, formed by the lower border of the teres major. 2. The lateral border, formed by the shaft of the humerus. 3. The medial border, formed by the lateral border of the triceps. Question: what structures pass through the intermuscular spaces? The quadrangular space. A. The axillary nerve. B. The posterior circumflex humeral artery. 2. The triangular space, or the upper triangular space. The circumflex scapular vessels. 3. The triangular interval, or the lower triangular space. A. The radial nerve. B. The profunda brachii vessels. Let's talk about the medial wall of the axilla. Let's remove the blue color of the medial wall. 1. The upper 4 or 5 digitations of the serratus anterior. 2. The upper 4 or 5 ribs. 3. The upper 4 or 5 intercostal muscles. This diagram offers a fantastic view of the medial wall of the axilla. 1. The upper 4 or 5 digitations of the serratus anterior. 2. The upper 4 or 5 ribs. 3. The upper 4 or 5 intercostal muscles. 4. The long thoracic nerve lies on the surface of the serratus anterior and supplies it. Let's talk about the anterior wall of the axilla. It consists of 2 layers. 1, a superficial layer, and 2, a deep layer. Let's insert the superficial layer. Let's insert the deep layer. The deep layer of the anterior wall of the axilla. Let's remove the superficial layer. Let's enlarge the picture. Let's remove the covering of the posterior and medial walls. What 3 structures form the deep layer of the anterior wall? 1. The subclavius. 2. The pectoralis minor. 3. The clavipectoral fascia. The subclavius muscle. This is the inferior surface of the clavicle. Origin: from the costochondral junction of the first rib. Insertion: at the groove for the subclavius. Let's insert the subclavius. The pectoralis minor muscle. Origin: the anterior ends of the 3rd to 5th ribs. Insertion: the coracoid process. Let's insert the muscle. Let's study the clavipectoral fascia. Let's isolate this fascia. Let's cut a cross-section in the direction of the yellow arrow and view it in the direction of the pink arrow. This is the clavicle. This is a groove for the subclavius. Its edges give attachment to the bilaminar part. This is the axillary fascia. Let's insert the clavipectoral fascia. Bilaminar part that encloses the subclavius. The bilaminar part unites to form a single layer, which divides to enclose the pectoralis minor. This is the suspensory ligament of the axilla. There are some variations in the definition of the clavipectoral fascia. I do not want students to feel burdened by all these variations. I am fine with them describing the clavipectoral fascia as it has been just explained. Pause to read the optional reading. We're still at the anterior wall of the axilla. Now let's study the superficial layer of the anterior wall. What is it formed by? It is formed by the lateral 3/4 of the pectoralis major. Let's insert the whole pectoralis major muscle. Now draw the outline of the pectoralis major and remove the muscle. The pectoralis major has 3 heads of origin. 1. The clavicular head from the anterior surface of the medial half of the clavicle. 2. The sternocostal head from the anterior surface of the lateral part of the manubrium and the body of the sternum and the adjacent costal cartilages. 3. The abdominal head from the aponeurosis of the external oblique muscle and the rectus sheath. Insertion to the crest of the greater tubercle of the humerus. Note that only the lateral 3/4 of the pectoralis major forms the superficial layer of the anterior wall. Let's remove the lateral 3/4 of the muscle. The medial 1/4 is the attached part and does not participate in the formation of the anterior wall. Let's push it to the right. The relationship of the pectoralis major to the clavipectoral fascia. Let's insert the pectoralis major. Let's cut a cross-section of the pectoralis major according to the direction of the yellow line. Let's remove the lateral 3/4 of the pectoralis major. Let's cut a cross-section of the clavipectoral fascia according to the direction of the green line. Let's remove the lateral part of the clavipectoral fascia. Let's insert the cross-section of the clavipectoral fascia from superior to inferior. This is the clavicle. This is the axillary fascia. This is the bilaminar part covering the subclavius. The bilaminar part joins together to form a single layer. This fascia envelops the pectoralis major, and 4 is the suspensory ligament of the axilla. Take note that the pectoralis major lies immediately anterior to the whole clavipectoral fascia. Let's insert the pectoralis major. To make it clearer, let's outline the pectoralis major muscle and remove it. This is how a vertical section would look like. Pectoralis major. Let's now study the lateral wall of the axilla. To understand the lateral wall, it is necessary to know the features of the anterior surface of the upper part of the humerus. Let's bring out the upper end of the humerus. Take note of the following features: the greater tubercle, the lesser tubercle, the crest of the greater tubercle, or the lateral lip of the bicipital groove, the crest of the lesser tubercle, or the medial lip of the bicipital groove, the intertubercular sulcus, or the bicipital groove. Muscle attachments. A. Pectoralis major to the crest of the greater tubercle. B. Latissimus dorsi to the floor of the intertubercular sulcus. C. Teres major to the crest of the lesser tubercle. Now we are ready to study the lateral wall of the axilla. We will view it in this direction. Let's take the lateral wall of this axilla and place it on this humerus. Let's place the anterior wall here. Let's place the posterior wall here. Note that the lateral wall is extremely narrow. Let's remove the yellow covering to see what lies beneath. This is the intertubercular sulcus. Inserted into its floor is the latissimus dorsi. We are back to the classical view of the axilla. Let's now study the inlet of the axilla. The inlet of the axilla is best seen from above. Let's remove all the walls of the axilla. Let's tilt the thorax anteriorly so that we can see the superior view of the inlet. Structures around the inlet of the axilla. 1. The supraspinatus. 2. The superior border of the scapula. 3. The suprascapular notch. 4. The coracoid process. 5. The clavicle. And 6. The first rib. What forms the borders of the inlet of the axilla? 1. Anterior border, the posterior surface of the middle third of the clavicle. 2. Medial border, the lateral border of the first rib. 3. Posterior border, the superior border of the scapula. 4. The lateral border, the coracoid process. Let's return to the classical view of the axilla. The inlet of the axilla. The inlet is also called the cervico-axillary canal because many structures from the root of the neck en route to the upper limb must pass through this space. The same is true for structures traveling in the reverse direction. Let's study the base or floor of the axilla. Let's insert the base of the axilla. Let's remove the anterior, lateral, and posterior walls. Let's see the base in the classical view of the axilla. Let's remove all the walls except for the base. Let's insert the outline of the pectoralis major. What are the borders of the base? 1. The posterior border, tendon of the latissimus dorsi and teres major. The lateral border, intertubercular sulcus. The anterior border, pectoralis major. The medial border, the serratus anterior, the intercostal muscles, and the fourth or fifth ribs. More about the base of the axilla. Let's insert the clavipectoral fascia. This represents the base of the axilla. It is formed by the axillary fascia, the superficial fascia, and the skin. In reality, it is not flat but dome-shaped. This part of the clavipectoral fascia is a suspensory ligament of the axilla. It is generally said that its function is to pull the axillary fascia upwards to maintain the dome. This diagram shows that the humerus is slightly abducted. If we fully adduct the arm, the axillary fascia will become very lax. Now, both the axillary fascia and the suspensory ligament of the axilla are lax. You can now use your hand to push deeper into the axilla to palpate structures higher up. This is why you need to adduct the patient's arm when you want to palpate for structures higher up in the axilla, such as the lymph nodes in cases of breast cancer. We are back to the classical view of the axilla. Let's now study a horizontal section through the axilla at this level. What forms the borders of this horizontal section? 1. The medial border is formed by the serratus anterior, the intercostal muscles, and the relevant ribs. 2. The posterior border is formed by the subscapularis, the teres major, and the latissimus dorsi. 3. The lateral border is formed by the intertubercular sulcus, or bicipital groove. The anterior border is formed by the pectoralis major, the pectoralis minor, and the clavipectoral fascia. Let's insert the pectoralis minor. Let's now remove the lower part of the pectoralis minor. Let's remove the upper part of the pectoralis minor. This is the cut section of the pectoralis minor. This is the section of the clavipectoral fascia. Let's now remove the entire image, leaving only the horizontal section of the axilla. Let's enlarge the section and view it in the direction of the arrow. Note the following structures. 1. The humerus. 2. The intertubercular sulcus. 3. The scapula. 4. A rib. 5. A thoracic vertebra. 6. A costal cartilage. 7. The sternum. And 8. The clavipectoral fascia. Muscles of the axillary wall. The posterior wall. 1. The subscapularis. 2. Tendon of the teres major. 3. The tendon of the latissimus dorsi. The medial wall. 1. Serratus anterior. 2. The intercostal muscles. The anterior wall. 1. The pectoralis major. 2. The pectoralis minor. The contents of the axilla are as follows. 1. The lymph nodes. 2. The axillary vein. 3. The axillary artery. 4. Some sections of the brachial plexus. What is the axillary sheath? Throughout their course in the axilla, the axillary artery and the axillary vein and the main branches of the brachial plexus are ensheathed by a firm connective tissue layer called the axillary sheath. What is the importance of this axillary sheath? The sheath is strong enough to hold local anesthetic injected into it to block parts of the brachial plexus for certain operations on the upper limb. This is often done from the base of the axilla. Adipose tissue. Take a look at the image. There appear to be many black spaces between the structures contained in the axilla. Do you think these are real spaces? No, adipose tissue fills the axilla between the structures. Adipose tissue is elastic and malleable and will always fill the axilla, even though the shape and the size of the axilla are constantly changing due to the highly mobile scapula and the shoulder joint. Let's insert the adipose tissue. The folds of the axilla. 1. The hollow of the armpit. 2. The anterior axillary fold. 3. The posterior axillary fold. Let's remove the skin to show the muscles. This is the anterior axillary fold formed by the lower border of the pectoralis major. This is the posterior axillary fold formed by the teres major and the latissimus dorsi. It is lower than the anterior axillary fold. The axillary fascia stretches between the anterior and posterior folds. It is covered by the subcutaneous tissue, which in turn is covered by skin. Congratulations, you have completed the study of the axilla. Now let's evaluate your understanding of the axilla. How to navigate through the questions. When the question is presented to you, 1. Click pause and answer the question. 2. Then click play for the answer and immediately click pause again to compare your answer. 3. Finally, click play to go to the next question. Click pause to read this. This lecture is for medical education and is non-profit. You have finished the boundaries of the axilla. See you in the next lecture.